Go live on Instagram. All right. All right. Hello, everybody. Hello and welcome. Okay, I'm looking over at my other screen. All right, we are set up. We are live in all the places. Yay for technology, right, Ryan? When it works.
That's right. That's right.
Beautiful day. All right. Welcome, everyone. I'm so glad you're here for today's live conversation and special training, I might add. I'm Leslie Vitale, and I'm very much excited about my conversation. I'm joined by Ryan Obermeier from Evexia Diagnostics. And today we are going to be talking about something that I think every integrative and functional medicine practice, honestly, you kind of need to understand. And that is how the cash lab model can actually help you to simplify your systems and reduce patient frustration. And believe it or not, this is really the big message. Increase the value of your diagnostic workflow. So Ryan is going to walk us through some real world steps that will help you to maximize your return on diagnostic laboratory services. And we're going to talk about why cash-based pricing can offer patients more transparency and affordability, believe it or not. And listen to this part, guys. Why tests are often 50 to 80% lower as compared to insurance billed rates. All right. So buckle up because this is going to be a great conversation, very eye-opening, and I'm excited to jump in. So welcome.
Thank you.
I'm excited to have you here, Ryan. Always enjoy our conversations, and this is such a critical topic.
I would agree. In fact, I'm probably most passionate about this topic with regards to this particular service line in any practice, again, meaning lab testing in your practice. I've been in the space for 27 years. I've only been at Evexia just over 2 years in the lab space. And it takes a little while, right, to have enough conversations, have enough observations to pinpoint really pain points, essentially, right? Mm-hmm. And over the course of my first, let's say, 18 months at the organization, I feel like today's conversation is probably the most important and certainly the one that I have the most passion about, because there's a lot of misunderstanding. There's a lack in fluency on cash labs and that model.
Okay. All right. Well, let's dig in. So what would you say, of course, when it comes to lab testing, because that's our topic today, what would you say is the biggest challenge that you see in practices within specifically the integrative functional space?
So when we talk, the conversation today is really going to be about labs. However, you can apply this particular answer to any service line in the practice. If you use IVs, if you offer nutraceutical intervention or health coaching, I think the greatest challenge to any practice for any service line, but today we'll be talking about labs, is really not monetizing these service lines. Mm. And what I mean by that is I think most healthcare professionals, maybe business owners, don't recognize what we call time and motion. What time and motion means is the amount of time and effort that it takes to offer labs to patients, right? It's placing orders, it's receiving boxes of supplies, it's putting the supplies on the shelf, it's physically placing the order for the patient, and then ultimately doing a quick review of the results and providing your commentary on that. And I think a lot of times most healthcare professionals don't recognize what I call hidden cost or lost costs. Mm-hmm. And they oftentimes will just try to pass through to patients the cost of labs. Head scratchingly enough, they don't have any problem selling nutraceuticals to patients or IVs to patients. But for some reason, labs never join that journey. And for some reason, and I think it's more of a culture thing here in the United States, that for most of us, we've lived in the insurance model. Maybe some of us in the audience practice in the cash-based model, but we still have an understanding, or what I would say limited understanding, of insurance. And really that's what today's conversation is going to be about, is helping the audience members become fluent in 8 talking points when they arise with patients that will give you confidence to communicate with confidence, with conviction, so you can help course correct with patients.
Okay. Well, we know that many healthcare professionals, at the end of the day, we're concerned about potentially nickel and diming, right? Our patients for every additional service. So, what are your thoughts on that?
I agree. Um, I have in the real world, I have the same comments.
Okay.
Going to a Starbucks and then them wanting to get tipped because they poured me a coffee, or buying a warranty for my refrigerator, which is basically insurance, and the fact that did you build this refrigerator right or did it not get built right? And I'm a patient, and I certainly feel that. I think that there's 2 pressures on the providers to pursue or follow the journey, let's say, or the workflow. That's probably better. Follow the workflow of insurance for labs. Number one is, I think most, if not all, healthcare professionals have the patient number one.
Mhm.
And I am not pandering to the audience, but people who pursue this different type of medicine, I would argue probably maybe even have a bigger heart. And you're always wanting to do what's right for the patient. And just because there's precedent with insurance and labs, that's just the natural flow. It's the path of least resistance. So that's number one. And then number 2, I just think it's the lack of fluency in insurance. Understanding the nomenclature, meaning, do you understand the difference between co-insurance versus copay? What's a premium? What's a deductible? We'll talk a little bit about high deductible healthcare plans. And so I think a couple things that are pressing on providers pursuing more of an insurance route with labs, where they're maybe running everything else through cash, is big heart. Hey, I understand that I don't want to feel like I'm nickel and diming my patients is one. But then the other thing is just not really understanding insurance. And there's no reason to understand insurance because you're in the cash world, right? But I think with today's conversation, like I said, I'm going to highlight 8 discussion points.
Okay.
And when they arise in the conversation, the audience members should be well equipped to address those with the patients at hand.
Okay. Would you like to? I think you have some slides that you'd like to share.
Sure.
Let's see.
Uh-oh. It's not. Oh, there it is. I was going to say, is it going to let me? Can you see my
There we
screen?
go. I can. Okay. There we go. All right.
Perfect.
Beautiful.
So as I mentioned, we're going to go over. So this is the magic 8 ball for all the younger audience members, but we're going to talk about 8 discussion points that for providers who are running a cash-based practice, who might still be running their labs through insurance. We're going to address 8 conversation points, 8 topics to well equip you to have conversations with patients about running labs through cash and not trying to leverage their healthcare plan benefits. So the first one is simply high deductible healthcare plans. Well, what is it? Well, a high deductible healthcare plan is, as it suggests, there is a high deductible attached to a monthly premium. So as a patient, and again, I'm a patient, after spending thousands of dollars every month just to have insurance, then there's something called the deductible. And that deductible needs to be met. It's a benchmark that needs to be met before insurance starts covering claims, meaning before the insurance company starts paying for it. Currently today, I often hear that high deductible, so again, after a monthly premium of thousands of dollars a year, is typically between $6,000 and $8,000. And in fact, currently today, I'm hearing upwards of $12,000. So again, if I pay $1,000 a month just to have insurance, once I start filing claims, and that all starts when I go do an office visit, I have to reach $12,000 before insurance even kicks in. And in fact, this is such a big deal. The IRS is involved in this conversation, and they have capped that deductible at $16,600, which means it's a big thing. And you have to ask yourself, as a provider in the integrative functional medicine space, how frequently do patients who pursue this different type of medicine, in fact, ever reach that deductible? And I would say, unless your patients are having a cardiothoracic procedure or potentially battling cancer, the likelihood of them consistently reaching that high deductible for insurance to kick in is not very, very likely. So guess what? That lab is all out of pocket anyway. So a great way to figure this out for your patients is just say, do you ever get billed for running labs? And if they say yes, then the cash lab is always going to be the choice. And remember, they may not get billed anytime soon after they have those labs. It could be months, many, many months after they have those labs run. That gets us into the second of 8 bullet points to be aware of and be well equipped to have great conversations with patients, because we all have a big heart, but we also want to maximize the service line in the practice. And this really comes down to pricing. So it is important to understand that labs are essentially priced in 4 different models: insured, uninsured, cash, and Evexia Diagnostics pricing. So if we took a very basic example of a CBC, complete blood count, most basic test you could ever run. Now, typically what I hear is a CBC will be reimbursed at $80 to $90, while the cash price is $27, while Evexia Diagnostics price for the same test run by the same laboratory company is only $5. Now, keep in mind, when we discuss these figures, I'm talking in very broad generalities. It does depend on what region of the country you're in, what insurance company your employer has decided to partner with, and then likewise, what insurance plan do they decide to offer their employee population for their insurance. Benefits are oftentimes viewed as a tool to attract talent and maintain talent, to keep that talent in-house. But oftentimes employers are also looking for the lowest cost solution, which typically is going to be high deductible healthcare plans. So look at this slide. In fact, some CBCs that have been run have received reimbursement of over $7,300, while it's very typical to hear $200. So again, big generalities, big brush strokes, understanding that these numbers aren't across the country, but historically what I hear is $80 to $90 for a simple CBC. Now, the pricing becomes very important when we discuss balance billing or back billing in bullet point number 6 that comes a little bit later in this presentation. The third of 8 bullet points that a healthcare professional in the integrative functional medicine space want to offer cash labs is understanding what is an HSA, what is an FSA. Well, HSA is a health savings account, and this is a absolutely wonderful investment model. Those dollars go in pre-taxed, they grow untaxed, and as long as it's withdrawn from that account for healthcare purposes, it can be used tax-free. And in fact, an HSA and FSA account can also be used for not just blood work, which historically that's what this discussion is about, but look at that. It also can address specialty testing. In fact, the slide that you have up on your screen calls out a couple specialty companies and tests. GI Map from the company Diagnostic Solutions Lab, Genova Diagnostics, and other functional tests can be ordered and paid for with the HSA or FSA accounts, which is wonderful, because if you're working with patients who are in a higher tax bracket, that's a significant savings. So a test that is originally $300, when you consider the tax break, it's now only $200. So much less expensive than what the price tag might suggest. The next bullet point is patients can always self-file. So again, the likelihood of patients ever reaching that deductible consistently, especially those that are pursuing integrative functional medicine providers, not all that likely, but I'm a patient. And if I pay a monthly premium, at some point, I want insurance to kick in. So one of the ways that I can take advantage of the best of both worlds is get those cash-based prices and then turn around and self-file. The process is very easy. You can actually probably, as I did here, just do a chat GPT and say, list out all the steps that it would take to allow my patients to self-file. But you can see it's a very, very direct approach. Here's one caveat. If you in the audience are a healthcare professional and you are contracted with said insurance company, I would highly encourage you not to discuss self-filing with patients with companies that you are contracted with. There is a high likelihood that might be against your agreement. So as an example, if you are working with a patient who is insured by Blue Cross Blue Shield and you have them run cash labs, do not discuss self-filing. But if you are not contracted with Blue Cross Blue Shield, go ahead and make that recommendation all day, every day. And at the end of the day, we patients will feel like we're getting the best of both worlds. The lowest price, but is still going to go towards that deductible, which again, today is probably going to be $6,000, $8,000, sometimes up to $12,000. The next bullet point, and this has really struck me, is really since COVID. There've always been certain patient groups out there where privacy is very important to them. In fact, we offer genetic testing on our platform, and I will say on a daily basis, patients will call our offices and inquire about, will their genetic data be destroyed or is it being saved somewhere? COVID has certainly highlighted this. I think we all can agree that for some patients, privacy has become paramount. Another thing to consider, though, is if you run labs independent of the insurance model, those lab results never get reported to the insurance company. There might be something that might have popped up in the blood work that the insurance company or the patient might not want anybody to know. So another good point about running cash labs instead of trying to leverage those through their healthcare plan benefits. This is the biggest point that we're going to discuss today, the idea of balance billing or back billing. So what is it? Well, if you as a healthcare professional order a test that has not been contractually agreed upon, the patient is going to be liable for that entire bill. Or if the lab company is requesting a reimbursement that exceeds the negotiated rate, the patient is going to have to pay the difference. So as an example, back in the day was homocysteine. For anybody who's been in practice for an extended period of time, homocysteine was covered by insurance, not covered by insurance, covered by insurance, not covered by insurance. And sometimes it was week to week. So if you ordered that test for a patient when the, when the test was not covered by insurance, the patient is going to receive that bill for homocysteine. But go back to bullet point number 2. They're going to get billed the insurance rate, $90 CBC, and not the $5 Evexia rate, as an example. So here's another real world example that I think will fit the bill. Maybe you, a family member or friend, maybe you've had to visit the hospital. And when you start reviewing the invoice, you notice that they charged your insurance company $13 for an acetaminophen pill, for a Tylenol pill. They charge them $13. Well, we know that that price is beyond reasonable and customary, right? It should be probably 13 cents and not $13. But they billed the insurance company $13. So when we talk about balanced billing, if a test is ordered that isn't covered by that insurance plan, or if the lab is looking for a different reimbursement rate that exceeds that, which we see here in this example, that rate, the patient will receive a bill for the full amount or the difference in those amounts. The patient's going to be paying $13 for an acetaminophen pill, not 13 cents for an acetaminophen pill. So hopefully that clarifies bullet point number 2 and what we're talking about today, bullet point number 6. Number 7, optimization. Not every patient who is coming to see an integrative functional medicine provider is looking for diagnosis or treatment of disease. Many times they just don't feel like they felt 2 years ago and they want to get back to that state. Those tests probably are not going to be covered by insurance anyway. So insurance really doesn't apply. And then last but not least, keeping a clean message. When the message becomes murky, it becomes very difficult, especially if you have a team that is working with you or for you. I'll give you an example. My previous world, I bought 40 medical practices in the integrative functional medicine space, and I saw it in real time in the real world, where the patient would walk up with the lab order and probably a test kit in hand and say, hey, the doctor wants to run this through insurance, but he or she says that this lab, the test kit, is going to get run through cash. Can you just see front of the house staff? Can you just see if we can run this test as well through insurance? Or another example, patient runs labs through insurance and then 6 months later, after getting IVs done, says, hey, I get my labs run through insurance. Could we see if we could run the IVs through insurance? I've heard that IVs can get run through insurance as well. It creates a lot of anxiety for the front of the house in those scenarios when there is a team supporting the healthcare professional. So here in summary, the 8 bullet points that our magic 8-ball provided us. Ask yourself, patients who consistently see you, do you foresee them consistently exceeding their high deductible healthcare plan? Deductible, if not, they're probably going to be paying cash anyway, and they're paying $13 for that acetaminophen pill, not 13 cents for the acetaminophen pill. They can always use their HSA, FSA accounts as long as it's for healthcare. Again, pre-tax dollars that grow without being taxed, and as long as it's withdrawn, the money is withdrawn, it is untaxed as well. Again, big benefit, especially if you're working with clientele that are in a higher tax bracket. Like me, I'm always going to self-file. I want to self-file because if there's any way for the insurance to ever kick in, I want it to kick in. So they can always get the best of both worlds. Get the cash labs, self-file. But again, remember the caveat. If you are contracted with said insurance company, do not encourage those patients with that insurance company to do so. Privacy is also important for some patients, especially since COVID. Balanced billing is a big deal. Is that test covered by the insurance plan or negotiated agreement? And is the rate also negotiated, or does it exceed the negotiated rate as well? Not every patient is here for a diagnosis or treatment. Sometimes they're just looking for optimization. And then last but not least, keeping a clean message. So with that stated, for anybody in the audience who is not registered with Evexia but would like to go onto our platform, it is 100% free. You can use the QR code. That QR code is going to take you to Leslie's landing page. That landing page is going to facilitate you accessing certain things that will be available to this group and this group only, not to the average Evexia Diagnostics client. That could be anywhere from white label marketing assets to tools that talk about cash labs. And those will be provided from Leslie to the audience members. We have some really cool tools that will go over the bullet points that we talked about today, and also some tools that you can utilize with patients and talking about cash labs. If you do have a current account and you have just specific one-on-one questions, you can use this QR code. It will take you to a calendar scheduler application, and you can schedule some time. And with that stated, that is my presentation.
I love it. So powerful. And, it all makes sense, right? It really does when you really dig in and start to think about those numbers. Really, really important stuff. So yeah.
It does. What I would say is I can't imagine anybody in the audience is going to hear the message once. That's why we're going to provide the tools to you.
Okay.
We essentially took this exact same presentation, used AI crunched it down to a 4-minute presentation. I don't even know how long we're going right now, but we're at 25 minutes.
Yeah.
Crunch it down so you can listen to it over and over again. And again, like I said, there's some tools. It's a change. It's a change in thought because in the United States, our culture has always leaned on insurance for labs, and we believe that that's the best route. One thing I failed to say is 7 out of 10 patients would benefit from cash labs. The example where they would not be benefited would be government insurance. So this would be Medicare, Medicaid, and TRICARE. And then some insurance plans as well. But for the most part, 7 out of 10 patients walking through any practice door are going to benefit from cash-based labs as opposed to trying to leverage the insurance.
Okay. All right. I have a couple more questions for you. All right. If we have the time. All right. I do want to ask a little bit about the Evexia Diagnostics internal physician network. Can you tell us a little bit about what that is and how we can leverage it?
Exactly. So we support any healthcare professional whose scope of practice does not include lab testing. So let's say, for example, you're a health coach, you're a registered dietitian. You can still order labs for your patients on the Evexia Diagnostics platform by utilizing our EIPN, Evexia Internal Physician Network. The fee is $5 to do so. In fact, a friend of mine wanted to run some labs on his wife. And I said, well, do you know any health coaches? Because they don't have an integrated functional medicine provider. And it just so happens his mother is an RN. And in fact, here's a funny story. I used to detail her about 25 years ago in Kansas City. So kind of came full circle. And
detail meaning you used to call on her.
When I in my previous world,
yeah,
I started my career in nutraceutical sales well before nutraceutical the word even existed. And part of what I did was Kansas City, and when I saw his text come through, I'm like, duh, I could have just suggested his mom, but it's been so long since I even thought about her. So
I love it. All right. So basically, I think the message there for everybody is you don't have to be a medical doctor or a DO or have, the ability to prescribe or recommend labs per se. Even if you are.
That's correct.
Right.
This is what I would say. I would say most people,
huge.
if you are that, you probably have a little bit of heartburn in running labs. I would say don't. A significant portion of our business is through this channel. And when I mean significant, it's significant. Okay. So we've been around for 19 years as an organization. The program has been thoroughly vetted. Again, we have resources for you to help you interpret the labs. If you need some help with the lab interpretation, you can email our clinical team 5,000 times a day at no cost if you pay a $50 fee per year. And then we also have something called a functional health report, which helps out with the interpretation for blood chemistry.
Okay. And that is unique to Evexia, right? That functional health report.
It is. It's absolutely fantastic. If you run a blood chemistry panel, it'll do the interpretation for you. And if in fact you do utilize dietary supplements or nutraceutical intervention in your practice, it'll actually recommend supplements as the intervention.
Oh. Okay, that's huge.
It's the unilateral solution. You do the testing, it does the interpretation, and it gives you the proposed intervention.
And health coaches, nurses, dietitians. I mean, really the full gamut, right? In terms of who can
Yeah,
order the tests.
exactly. In fact, my call right before this presentation, I live in the middle of nowhere, Washington State.
Yeah.
The person is a 45-minute drive from me, and she was a health coach.
Okay. Beautiful. All right. So that is super helpful. So, Ryan, as we start to wrap up our conversation, I always love talking with you. I learn so much every single time. Do you have any final thoughts that you'd like to share with our audience today? Maybe a couple of things, one or two things that our audience can immediately implement.
I do. So if you listened to my presentation last time, which was a couple months ago, I talked about this concept of working on the business as opposed to the business. And I think the big key of that is actually getting it in your planner, on your calendar. And it
Okay.
can't be on the weekend. It has to be a business day. So 1 or 2 months a day, I think it's important to calendar getting offsite and starting to work on the business as opposed to in the business. The second thing that I offered last time was know thyself and understanding what environment do I need to be in as a business owner to get in the flow state? The flow state basically means it's a state of mind where the ideas just start flowing and you can barely even keep up writing all your ideas down. I shared with you, for me, my flow state is two unique areas. One is a very busy Starbucks with all the white noise that helps me get in a flow state. And then the other area is doing a walk, or excuse me, a hike by myself. I get in a flow state. Here's my next bit that you could add on to this. And honestly, timing could not be more perfect. Between now, the end of the year, or maybe even a couple weeks into the year, you can use this as well. So you take this idea of working on the business as opposed to in the business. And what I would say once a year, if not a couple times a year, maybe 2 times a year, ask yourself these 3 questions. What do I need to start doing as a business owner? What do I need to stop doing? And what do I do so dang well that I absolutely need to protect at all costs? And then if you work on a team, you want to ask this at 3 levels. As an organization, what do we need to start doing? What do we need to stop doing? What do we need to continue? Then as a team, and then as the individual. So essentially, you're going to get 9 squares, if you will, on a grid with different answers. If you work on this project with a team, have everybody participate in giving them their answers, and it's going to seem like chaos if you're writing them all down, which I've been leading teams since 2006. This is an exercise that I do every year. It seems like chaos, but then when you start looking at it, you can start grouping answers, and then you can start putting priority to it. So you might get, I don't know, 50 answers to those 9 quadrants, or maybe even more. But I think once you boil everything down, you're going to have a significantly shortened laundry list of items to accomplish in the coming months, weeks, or even year.
Such great advice. I love that. Any final words of wisdom that you want to impart? And also, how can we learn more about you and continue our journey with Evexia?
Well, you can follow me on LinkedIn. It's just Brian Obermeier, and you can look
Okay.
up Evexia Diagnostics as well. And then the last thing is, I would just encourage you, if you don't have an account, use the QR code that I put up on the screen before. It will send you to a landing page. That's going to tie you to Leslie's group. And Leslie's group has a whole bunch of benefits that the average Evexia Diagnostics client does not have access to. I mentioned white label marketing assets, but also the tools that I mentioned for this discussion on Cash Labs that we'll get out to you as well. Super simple process. Registering is for free. If you want to upgrade, it's just $50 a year. That grants you access to that functional health report, and then access to our clinical team for lab interpretation.
Okay. All right. That sounds great. And I have included the bit.ly version of that link on your screen. So you can go ahead and type that directly into your browser to open your account and get yourself started with Evexia. All right, everybody. I want to thank you so very much for joining us today. And a huge thank you to Ryan, as always. for sharing these important insights, especially, when it comes to cash labs, such an important conversation, and specifically how it can help support you and your patients inside of your practice. So again, if you're ready to implement, ready to get yourself started, the next best step is to get yourself going, get an Evexia Diagnostics account. You can, again, use that bit.ly link or use the link that Ryan showed earlier, that QR code. All right. So I want to thank everyone for being here, and a big warm thanks to Ryan. I really appreciate your sharing your wisdom with us today. All right.
Thank you.
Thanks, everybody. We'll see you next time.